Hey everyone, welcome back to my channel, and if you are new here, I am Mariana and I interview the brightest minds of physical therapy. So if you want to increase your knowledge, start right now by subscribing to the channel, clicking on the bell so you don't miss anything, give us a thumbs up and share this video with your friends and colleagues. Today, our guest is Chris Wolfe, and he is a physical therapist and runs his private practice that specializes in athletic adults and athletes with concentration in the endurance athlete. I hope you enjoyed the show. Hi Chris, welcome to PT Pro Talk. How are you today?
I'm doing fantastic. How are you?
I'm good, and I'm happy to finally get to our conversation. After trying for a couple times, now finally worked, so I'm excited. So let's jump right in. Could you tell us a little bit about yourself and your career, and how did you get to where you are right now?
Yes, so I've been practicing for 14 years now. So when I think about reversing back to where we all kind of started, again, I'm Chris Wolfe, physical therapist by trade, and I've been practicing in Nashville for 14 years. I graduated from a program in Georgia, in Augusta, Georgia. That's where I grew up, outside of Savannah, Georgia. And I did my undergraduate work in Tennessee. Really, at the time, comically, I did that just to get away from home, 8 hours away. But it put me in Tennessee, where I did my undergraduate work in biology and chemistry. And I fell in love with Tennessee. And it's an interesting story that we may not even get to, why I think I fell in love with Tennessee, that I didn't really find out until 14 years later. But that's a different tangent for a different day. But anyway, and I did, I fell in love with physical therapy really just by chance in high school, where I drove my parents crazy trying to figure out what I wanted to do as a profession, probably like most students do. And I volunteered at a physical therapy clinic after reading about it. And I fell in love with the act of truly what probably brings most people to physical therapy, helping people. I had no personal experience with it. I was blessed with not having any major injuries in high school. I fell in love with it because I saw a mother working with an occupational therapist, and her being so emotional about being able to perform well on a pegboard. And that, those who don't know what that is, it's working fine dexterity of your fingers and being able to put a pin in a hole in a piece of wood, which most people would not even realize what that means. But what that meant for her is that she was able to hold her baby. And that impacted me. It still impacts me today when I tell that story. And I knew then, I was like, that's the impact I need to have on people. I need to have a physical impact on them. And I wanted to be a part of that. And so from high school, I entered into college knowing I wanted to do PT, but I was told, hey, most likely you're going to change your degree or your major. I think the average is 7 to 8 times for this collegiate student now. So I was like, okay, I guess that's statistics. They don't lie. So I'll do pre-med. So I did pre-med, but I never changed my mind. And I was blessed to be in a somewhat challenging program of biology and chemistry that I couldn't wait to get out of, because learning and writing about the lifestyle of pine trees really is not really what I wanted to do. But I applied to PT school. I was accepted, and then I went straight through that program, and I did all my rotations in Tennessee because I knew I just wanted to live in Tennessee, and I wanted to network and get good connections. And then as soon as I graduated, I took my boards in Tennessee, and that was at the very end of 2006. And I packed up my vehicle and I moved here the day before I turned 25. And that day will stand out to infamy for me, just being the milestone for good things to happen. So that's a little bit about my background. And just I've been, again, since then, I've been practicing in orthopedics and sports medicine for going on 14 years now.
Nice. So I know you have a private practice. Yes. And your public's a little different. So you see athletes and athletic adults. So do you want to tell us a little bit about that? I know you said that they have a distinction between them. So let's talk about that.
No, I love to. I worked in outpatient orthopedics, sports medicine for a little over 10 years. And obviously I was able to gain valuable experience and knowledge and really find out where I wanted to kind of somewhat specialize in. And from my own personal experience, when I turned 30 years old, I just kind of made a promise to myself, not that I was in an unhealthy state, but just like most people do, you make milestone goals. And I wanted to be healthier in my 30s than I was in my 20s. And I have a running background where I just enjoy recreational jogging and running. And I started mountain biking a lot in Middle Tennessee, and I've always done that. And I wanted to start road cycling. And then I started thinking about adopting that into swimming. And I'm a terrible swimmer. I was a horrible swimmer, which again, we could go into stories about that anyway. I entered into a community of triathlon, and I started falling in love with that sport. And I then started diving deeper into what goes into that sport from a healthcare side, keeping people active. And I loved that. That's almost like a lifestyle sport where you can grow old in, and you can be considered an athlete as an age group athlete, not just from high school and college, but also somebody who's racing triathlon in their 50s and 60s. And thriving in that. And I love that. And I was welcomed into that community as I started racing triathlon, and I started concentrating on my marathon distance as well. And I started having this love interest of reading into the research and knowing how best to serve and treat the running athlete of all ages and the triathlete. And as I started to work with that, I started to specialize in endurance-related injuries, and which can be found in swimmers, in cyclists, and in runners, and primarily runners, because that's a challenge. That's more hard, and it's harder on the body in different ways. But I started basically soaking up every single piece of information I could find. I started following good people, started being mentored by other great clinicians that did well, started concentrating my CEU courses on those type of injuries and those type of athletes. And eventually I knew that if I wanted to take my level of knowledge and practice to another higher level, I needed to work with that community very closely and more of a one-on-one basis. And that's when I decided to open up my private practice, concentrating on what I say, motivated individuals, because those who enter those type of sports or want to stay in some type of athletic realm for their life, they're motivated. This isn't somebody you have to talk to into being compliant with exercises or being compliant with getting off the couch. They're self-motivated, and working with somebody who's self-motivated, independent, is such a beautiful thing, because all you have to do is just give them tools and educate them, teach them to fish, right? So that's where I started doing my private practice, where I wanted to be able to move outside of a normal clinical setting. And I wanted to be able to look at an individual from a very holistic standpoint of health and fitness and truly healthcare, and try to help people get out. I wanted to work my way out of a job, basically. I wanted to work my way out of being a healthcare provider and truly teach the person how to be healthy and fit, and being able to get back to their level of competition, wherever that may be. And so what I tell people, I try to move them toward their goals of health, fitness, or performance. And that pretty much will cover pretty much anything. If somebody just wants to feel healthy and be able to be active with their children or be a weekend warrior, I love that, wherever that sport looks like. My specialty is definitely running and endurance sports, but with my background, I can help in many other areas. And but those who want to work on maybe they are a high school or collegiate athlete, or maybe they are an age group athlete, or somebody who's truly going toward a performance where they're not even hurt at all. They just want to look at, how do I actually get better? And unfortunately, in a normal clinical setting, physical therapists, our knowledge base on certain issues, we aren't really equipped to know how to take somebody to that level. In teaching in academia now, we're not designed to teach people really how to take somebody beyond a good subacute phase or out of their after their initial injury, turn them back into true function and true performance. Oh, lost my light again. Speaking of academia here, I'm coming from Belmont University, and one of the best ways that we save money here at Belmont is having our lights on automatic switches. So if I don't move around and flail around enough, they'll think that I've left the room, and they'll shut the lights off.
So if you see him like lifting his arm,
that's exactly right.
You know what's going on.
That's right. If I just have to kind of talk very much with my hands, you'll know why. So I knew that truly moving out of the healthcare system into true life and back to physical activity, you have to move beyond somebody being stuck in the medical system. And unfortunately, physical therapists we're very well and very good in being trained to get somebody about 80%. And that's kind of in the research right now, where most people, after having an injury, they basically say that I was able to get 80% improved. And that 20% seems to be so elusive and be so difficult for people to get. And unfortunately, it's very hard for people to get that back unless their care is very individualized and you truly can sit down and learn what someone's true goals are and how do you actually work beyond the table, from what I say, and truly when you're getting your feet planted. And how do you know, and are you educated enough to help somebody discover what their sleep cycles are, what their true hydration levels are, what their true dietary needs are, what their true fitness levels are, and how do you actually work that around their lifestyle of work? And can you actually spend time and dig in with somebody about that? And I think that's what it takes in order to move people from 80 to 100%. And I knew if I wanted to work on that 20%, and that's really my niche. I love working with somebody from 0 to 80, but what I try to create an environment for is that we thrive on the 80 to 100. And because it takes that extra push and that extra knowledge, and it takes a while to gain that extra knowledge to do that. So my practice now, we focus, again, that's a long-winded answer, again, on active individuals, moving them toward, again, their health, fitness, or performance. I specialize in running and endurance, and then I network very closely with wonderful strength coaches and other good coaches as well. So we move that person toward strength training and learning truly how to become healthy. And that has to go beyond what you do on the table.
Yeah. So I think that was very interesting, everything you just said. And I have some background working with triathletes as well. So we know, like, if you want a performance, you can't just do the traditional way of treating, because what they do with their bodies, it's insane. I think you finished one Ironman, didn't you? I read somewhere.
Yeah. I've got one full Ironman distance under my belt. It's funny how I say I live vicariously in that community right now. I concentrate more on the marathon distance right now, but I raced for 5 years between sprint and Olympic, and then half iron distances for several. And then I did my full iron distance. My wife was about 8.5 months pregnant with our first little girl. And so I think she walked, I think her pedometer says she walked a half marathon that day of my race just for viewing. And she was 8.5 months pregnant. And after that race, I love the sport, but I told her I would back off from the amount of time and training I was doing there so I could just be more present with the family. And so it was easier for me to concentrate on one sport, on the marathon, from a performance standpoint. And then I bike and swim recreationally now with the goal of stepping back into that from a competitive level. Time is of the essence.
So it's interesting because I'm from Florianópolis, South Brazil, and we have Ironmans every year. It's like one of the places that they do. So I work as a physical therapist for 3 or 4 years, I think. So we were there since the time they started. It was like 6 or 7 a.m., I don't remember. And the technical limit of the whole thing, it was midnight. But we stayed there after. It was people coming after midnight. And it was like, just, oh my God, like, it's crazy. People really, they are here because they want to do this to themselves. They just come like on the finish line. Just barely walking. It's just crazy. So
it's a beautiful sport. again, one that I love being a part of. And even if there's slight delays in competing, being able to help those individuals feel better and perform better, I love it. I love it so much.
Yeah, it's fascinating. And what you said about the self-motivation, you don't need much to convince them to do their homework. You have to convince them to don't overdo their homework.
Yes, so much. And that's why it goes beyond. It goes beyond just saying, yeah, do this on a sheet of paper. It's so much more beyond that. And those who know the sport, and I think that's why those type of athletes, they want to work with somebody who knows their sport, because that's not the person you tell them, oh, just do less. Oh, this isn't working. Oh, just don't show up that day. You're like, that's not an option, right? So understanding that athlete, having that mindset and being able to discuss with them and look at their training plan, that speaks volumes to somebody. And I think that's really where I've been able to kind of help that, where I can look at someone's training plan and I can understand it. And I can help write training plans. And then I befriend and I work really well with their coaches, and having a conversation with a coach on the phone, and they're adjusting that person's training plan before they walk out the door. Who doesn't want to be a part of that?
Yeah. And the volume of trainings is crazy.
Yeah.
It's so huge. It's just, yeah. And so now let's talk about your approach. So how do you treat these patients? Like what tools, techniques you use?
So that's such a great question, and that continues to evolve. And that's what's beautiful about working with that population and seeing the more and more become educated, figuring out how best to use the tools to interpret the information. Because there's always better mousetraps coming out to get the same job done. And that's just the beauty of technology nowadays, where there's going to constantly be software coming out and camera systems and information and watches and Garmin, new updates to Garmin information. And we can be so riddled with data, and we love it, but nobody knows how to truly interpret that data. Nobody knows what to truly do with it. And that's where I think a lot of the art comes in. So when I work with somebody and they contact me, I usually try to jump on a phone call with them, which is now being in private practice, giving me the ability to block off 20 minutes, 30 minutes on a phone call before I even see the person. So I can even determine, am I the right person for you? Because this isn't about me trying to get constant people in to kind of come see me. I want to make sure that I'm the right person for them to see. My practice is the right person for them to see. And many times, majority of the time it is. But there's so much of a connection you can make with somebody on a personal level, which helps you so much when you're trying to help them through whatever is force them to call you. But discussing them and getting an idea and a glimpse into what the nature of the call is. And somebody contacts me, it allows me to determine then, when I set that appointment time up, how much time do I think is going to be needed for that first appointment. And in my practice, we're blessed with the ability to be very fluid with that. So a gentleman that contacted me the other day who came out of a half Ironman distance 2 weeks ago and was suspicious of a lateral foot problem on the outside of his foot, and knew that was going to be a very simple assessment. And as we discussed on the phone for 20 minutes, which was a lot of my history taking anyway, I blocked off 30 to 45 minutes with him and screened him for a stress fracture and advised him on that, versus a young man who came to see me he's a high level high school runner. I blocked off 2.5 hours with him. And so that assessment looks different, because talking with him on the phone, knowing how deep do I need to go with this person is going to be different. And I need to capitalize on that. And when somebody comes to see me, I spend a lot of time getting to know that person and talking with that person, and not rushing through my history taking, and having a real conversation, where I keep a marker board, a whiteboard on my wall. And what I typically do is we outline a timetable from when they entered their sport and their entire medical history. We write it out together. And that's been so powerful, not just for me to be able to see connections, but for them to be able to recount and see connections. And then we sit on the table and we brainstorm. And so that's many times where I say, listen, I'm not the doctor in front of you telling you what the problem is and what you're going to have to do. I want to enter into a conversation where we truly brainstorm together, because they're the person living with this and they're the biggest source of information for me as well. And I'll brainstorm with them on like, what caused it? What's it going to take to get after it? And then what do we look from a prevention standpoint? So we spend a lot of time discussing. A lot of times I'll spend somewhere upwards of 45 to an hour talking with somebody and outlining their past medical history. I had to get very comfortable asking very sensitive questions, right? Just about some eating disorders and bone stress injuries. Different, if I'm working with a female, talking about sensitive questions there. If I'm working with males, because there's so much that goes into healthcare beyond just 3 sets of 10 of exercises. It's so much. And those who don't understand that, unfortunately, will always be limited in what they can do in their world and what they work with patients. But so we spend a lot of time understanding that. And one, that builds a ton of rapport. They know where I'm coming from. They really know that my buy-in with them. And when they feel that they're not being interrupted, they can tell their story. Many times that's the first time they've been able to do that, because studies show that the time that a patient has with a clinician or a physician is about 2 minutes. And that person's interrupted about 23 times within those 2 minutes, because time is money so much in the healthcare industry, and they're just trying to get to a fast solution. And I try to remove that. And being able to remove that, I've been able to make and help people and lead them towards some beautiful outcomes. And we're blessed with being able to travel that road together. So again, I think that's very impactful. And that's not even before I use assessment or physical assessment or objective measures. I spend so much time with that. And that's probably one of the biggest things I stress. And I try to educate people on not to rush through that process. And then when my assessment process, learning that, it helps me to dial into how do you take how do you get so good at the fundamentals of a physical assessment and pull from every source of experience that I have to do a really good physical assessment on the table, off the table, and then a performance assessment. And then if that is a running athlete, and I think that's kind of what we're discussing right now, and not everybody is, and that's okay. If it's a running athlete, then I take the time to figure out what I may or may not see with them running. And then we'll spend time on a treadmill where I'll do a video analysis, and then I'll determine if I need to do some software analysis where I'll utilize a company and a software called dorsaVi, and it's basically wireless sensors that fit on the person's tibias, and it spits out information that may or may not be helpful. You kind of have to know who you're working with and know how to interpret that information and that data, and to see if it's relevant or not. That's why that whole process is so important, to get to that point where you then look back into what's in my toolbox, where I'm going to make the largest impact for this person today. A lot of times it's digging into their training regimen, because with what we know right now, current evidence shows that 65% of running-related injuries are due to poor programming and poor training. So that just means 45% of injuries are only related to actually a true weakness or a true tightness. 65% is poor programming and poor decision making.
That's a big number.
It's huge. It's huge.
Yeah.
So if you are only looking at somebody from like, I need to give you the proper exercise or the proper stretch, you're only going to get 45% people better. Yeah. And I would say that probably percentage is probably even skewed. So if you can't even interpret that person's sport and know how to talk to them on so many different levels than just the physical side, unfortunately, you're going to be 45% better. So that's why I spend so much time digging into all those other aspects. But then looking at somebody running from a video analysis and being able to break that down frame by frame, and tying into everything we discussed, everything that we looked at them objectively, and reviewing that with them on a flat screen TV and going by that, and then looking at some of the software data that shows maybe what the video doesn't pick up on. That's that value that a lot of times that will bring. And then it's up to us to determine, is this relevant? Do we use this as something we change or just a measure of success for later on down the road? So sorry, again, a very long-winded answer to what does that look like for an appointment?
No, I think it's huge that you said that you separate so much time, because that's something that we don't have on healthcare usually. So it was funny that my husband, he went to his doctor yesterday to do like his physical, and he was like, I like him because he looked me on my eyes. I was like, what? So like, you should be like, okay, now I like him because he looked at me. That's like the bare minimum. And like, we don't get that. I was just crazy. And the treadmill, I think that's very interesting because it's like a good resource, like to do this video analysis and then these sensors. But also another question that I have about that is, so sometimes you see adaptations and like how to do if that's relevant or not, because sometimes it's how they adapt to perform to, you know, and then you change that, and then you change the technique and dynamic of how they run or perform. So how do you differentiate that?
That is such a great question. It's a tough question, right? Knowing who's in front of you. When I'm educating, teaching people how to work with a runner, and I think this, I say a runner because that's kind of what we were talking about right now, but I think this is very relevant for anybody in their sport or their passion. Are they brand new to the sport, or have they been doing it for years? Because the way that you treat and educate that person, the way that you program for that person is totally different. Because what we know from a novice runner, somebody who's just entered the sport, they are most prone to certain running related injuries in the first 2 years, versus if they can survive the first 2 years of adapting that sport, their running related injuries change completely after that time. And if they sustain an injury that lasts longer than 3 months, that program almost starts over again because their body has maladapted to that. Because the body can be catabolic in nature, where we start to break down if we don't apply loads. And the body is beautiful from the standpoint that if we have adopted a certain adaptation or a compensation for something, you have to be very strategic to know, do you start to mess around with that and change that? Or can you understand that person's body or past medical history so well of understanding they have to do this in order to do the sport? If you start to change this, it will have a ripple effect and have so much of effect on other things, and you've lost the whole concept. And I think that's important for people to know, because a lot of people, it's sexy to say that, yeah, we're doing running analysis, we're doing treadmill analysis, and we're doing this and this and this, and we're getting all this data. And that's when I go back to saying, yeah, that's really sexy to say that. But it really comes down to, do you really know how to interpret that? And do you really know how to utilize that data? Because you can know running terminology, but if you just start trying to pigeonhole and make everybody look the same, that is not the route. And no one runs the same. No one should look the same when they do a certain exercise. And then understanding the person's body, where they've come from, where they want to go, like what are their major goals from a performance standpoint, or what are their goals from just recreationally. That has to dictate where you go to start changing certain things.
Yes, I think that's huge. And you're just able to understand all of that, if you are able to take a good history and have a good subjective exam. So I think that's just complement each other. And that's why when you're rushing patients, you can really do that and have this outcome.
That's right. When you don't have the time to dig in deep individually, then you have to be careful about making such changes, because you really don't know what effect you're going to have on that. So
you don't have the big picture. You don't
have all the details. Different. That's the difference between working with an Olympic qualifier marathoner and what her goals are totally different than working with somebody who's just into the sport for two years ago, and they're just trying to run their first half marathon, right? Yeah. They both have the same goal. They want to perform in a healthy way, but the way that you address that one person and how they should be performing or exercising or programming is totally different than the cues, the running cues, or how you interpret information on somebody who is who's being paid to run.
Yeah. And this that you said is 65%, I'm just surprised with this number, because I wasn't imagining that would be that much the impact of all the training. So that's very important to have a close relationship with the coach or with who is planning their training, right? So
yes, or just talking to the person and saying like, do you actually have a plan? Right, because a lot of people don't, and you don't say that. You don't say that in a judgmental way, and that's why you're trying to build a rapport with this person. So it's all about how you communicate and how you motivationally communicate. An interview with somebody is so powerful. Just understanding what has led to this, and I need to be able to make a decision. Is this really just a reflection of poor programming? Because if it's just a reflection of poor programming, then if I don't fix the programming, everything else I give this person is probably null and void. And maybe I don't need to give them anything. Maybe I just need to teach them how to program better. And so a lot of times I've had sessions where I'd literally do nothing for the person except build a program for them. And once I understand that, they're like, this is fantastic. I feel so much better because now I actually have a plan and to follow. And I didn't walk away with a sheet of exercises. And that's just because I've understood the person and understand where they're at. So
it's so big, like you can help the patients in so many different ways and perspectives other than just giving exercise. I think that's huge once you understand that and you are in a very niche market.
Yeah,
I think that's amazing. And so now talking about a little bit the treatment. So what do you usually do? You use more exercise, you use a lot of manual therapy, you combine both. I know it depends on the patient, but like what do you think it's the most common approach needed?
So it's so easy. The easy answer to say depends, right? And that's physical therapists are beautiful at saying depends. Right? So teaching students, they're like, oh my gosh, please tell me the answer. Don't say depends, right? So but with that, yes, there's a time to be hands-on manual, and I have a manual background, and then there's a time to use that, and then there's a time to get away from it. Honestly, because I think a lot of current evidence doesn't support the long-term use of manual therapy for long-term outcomes and goals, because you must promote independence. And if you're going to promote independence, then you have to move eventually away from a heavy manual therapy basis, especially for someone who's trying to work on resilience of tissue. I say resilience of tissue, it means bone and tendon and muscle, and all of those need load, and you need to be very. There goes my light again. But that also needs to be like. You need to you need to understand on a cellular level how you can improve the tissue of bone, muscle, and tendon and joints. And through my years of experience, people always ask me about like, Chris, where do you get your exercises? Or like, what are you doing different from exercises? And it's like, I don't pull my exercises off of the Instagram where you're trying to see the sexy approach to these really hard things that most people have no business doing. I've entered back into the true strength and conditioning world, where you learn the basics of true strength and conditioning. And that's really where somebody should be moving from physical therapy exercises, where you get away from bands, where you get away from off the table, and you truly learn how do you load tissue? How do you impact bone to make it actually heal 74% faster for an osteopenic bone in 16 weeks versus not 74% faster, how most people are treated from a stress fracture or something, versus how do you know how to appropriately load a tendon for a tendinopathy and tendinitis and keep somebody running versus being sidelined in a boot for 12 weeks. So I have to move away from hands-on manual therapy, which I do to a certain degree, and I'll do soft tissue work, joint mobilizations. I'll do repeated motions. I'm a McKenzie-based therapist. I'm also a Mulligan-based therapist. I'm a Maitland-trained therapist. So I pull from all of those to see, how do I get my best results for who's in front of me? Do I use dry needling? I use dry needling a lot too. Again, a better mousetrap to maybe get a quicker and better result, so I can get the person up and treat them actually how to weight lift. How do they squat? How do they hinge? How do they carry? Can they do a clean step up? And then how often should they do that? And I'm trying to become very good at dosing, meaning how often should somebody truly do an exercise? Okay, because it's difference between you give somebody 3 sets of 10 versus 4 sets of 6. And you teach that person how to exercise twice a day, 3 days a week versus every day versus every other day. And so that's what I try to utilize, a lot of knowledge base of knowing, what are you working on? What are your goals? And do you understand the tissue that you're working on from a cellular level, and where the person comes from to know how to make that exercise better? I don't teach people how to do anything different than maybe another traditional therapist does, or a strength coach. I try to combine them. So I do a lot of weightlifting and training with my patients. And many physical therapists, unfortunately, don't have the opportunity to have a weight heavier than 30 pounds in their clinic. But most of my clinics, I'm going to be teaching somebody how to squat or deadlift or carry upwards of 90 pounds or 100 pounds, because that's what the body needs. When somebody runs, when you make impact to the ground, you're at least loading your body 2.5 times your body weight with every single landing phase. So eventually, a clamshell or a sideline leg raise on a table is not going to do it. You're going to have to train that person under some serious load and know how to dose that person appropriately, so that way they can meet their goal.
Yeah, I think that's I'm so glad to hear all of that, because that's very different from what you're used to from the traditional physical therapy. And I come from some sports medicine background as well, that we were able, when I was in college, we had this project that we just saw athletes every day, and we were able to take them to like a soccer field and and play and test and shoot some balls and run and jump and carry weights. Would take them to the gym. So we did like until the end, like the real, like as you said, make them like functional and prepared to perform as much as they can, and develop all of that. That I think it is a missing part on the clinics, I believe, because we have some weights, but we don't have the space, we don't have the time, and many times we don't have the equipment to do that. So I think
unfortunately now.
Yeah. So that makes the difference on the last 20% that you said, that we have to, finalize the treatment. So I think that's very interesting. And I think that's a great work that you're doing. And I'm happy to hear someone is doing that, because it's very needed, right? It's much needed. And I think most places don't have this. So Chris, anything else about this part of the athletes and the treatments? Anything that you want to add on top of everything we said?
Well, I probably have said quite a bit about that. And I know a lot of people will ask me, they'll see, even on the website, we highlight some of the treatments that we do, or the analysis that we do. And I say we because, it's not just me in my practice right now. I've been very blessed to surround myself with really good other therapists that have the same mindset. I have another therapist that works with me. He has a running background and a coaching background. And I'm mentoring him on everything that I'm learning as well, teaching him how to do really good running analysis and work with endurance athletes. I also have 2 other therapists that work with field sport athletes, and they do baseball analysis, pitching analysis, and recording of that. And, I use a dorsaVi technology, again, like we talked about, that kind of gives me some information on just ground reaction forces and just like loading rates of how somebody loads their lower legs, and how quickly and how stable it actually looks on camera. But again, the true art and the true way to help somebody is knowing truly how to interpret that. And I don't think that's necessary with every single patient. I don't use it with every single patient. I think that's why I try to highlight everything that I mentioned before. Don't rush through truly knowing who's in front of you and then understanding what you're actually working on, and pushing yourself to know, like, how do I get this person more toward traditional healthy fitness goals? And do you even know what their goal is? Meaning, do you need to take them to a field? Do you need to keep them indoors? Do you need to go with them to the gym? Just to understand that. But
yeah. And so let me just ask you the final questions.
Sure.
So what is your favorite resource of information? So you just mentioned a lot of different approach. So do you have a suggestion for someone that is more interested in learning more about that? So what would you recommend?
Yeah. So I get that question quite a bit. Mainly we say, Chris, what's your source of information, right? Because we're all busy and it's hard to look at every single thing individually and sift through all the stuff that's not worth looking at. So a lot of times the biggest piece of advice when people are trying to follow a ton of people online or on Facebook or social media, you're going to waste so much time doing that. So I usually say, research the people who are trying to make the biggest impact and pick 3 people out and follow just the 3 people. And that was a big piece of advice that was given to me. That's not unique to me, but it's so true. If you try to have 8, 10, 15 people that you're following, most likely only 3 of them are worth following and worth putting out enough information. So you're really just wasting your time on the rest of them, unfortunately, because if you're watching everybody else, you can't watch the big players who are important. So one, having a mindset of narrow your focus, that's so important. And then follow what's being put out there. So for resources and information for me, if somebody has a big interest in the running background, in the running world right now, I'll just stick with that. The big players right now that I think are putting forth so much great information out there, and then they're doing a good job of summarizing all the research out there. My clinical mentor that I consider is Chris Johnson, who's based out of Seattle, Washington. A part of his Runner Zone cohort, which is an online platform that people can request to be a part of. But it basically ties in good running therapists and clinicians from all over the U.S. and internationally as well. But Chris Johnson puts forth so much good information. His partner, Nathan Carlson, based out of Kansas City, and then Joel Satkus, who's based out of North Carolina, who's in academia as well. Known them for years. I'll pretty much read everything that Chris puts out. He's been very impactful for me. Jada Sherry, who's based out of Bend, Oregon. He's put out some great books lately. And he puts forth great information out there. He's definitely a biomechanics background. But if anybody's interested in true running and understanding that, I would say read everything he puts out as well. And then Tom Goom, based out of Europe, who's the running physio. You can find him online pretty easily. So those are kind of the 3 people that I would say I would just kind of narrow your focus down: Chris Johnson, Jada Sherry, and Tom Goom. There's so many more out there, and if anybody out there too, I don't want to not highlight somebody, but again, I'm trying to practice what I preach, where you try to narrow your focus a little bit, and basically tying in with them. If they're going to be following or highlighting somebody, you know that they are noteworthy and you should follow them. And I could go on a much longer list as well, but I've really connected to that longer list through those 3 resources. From a strength and conditioning standpoint, if somebody really wants to know how to really take strength training to another level, which I think is so powerful, Dan John, who's based out of Utah, is so powerful with the information he puts out, and it's so relatable for a clinician as well. He's not a clinician by background. He's a field sport, a track and field coach, but is one of the smartest people I know when it comes to strength training, strength conditioning, and me layering that information on top of a medical background has made all the difference.
Wow. Okay, we have a good source of information so everybody can look up. I'm going to make sure to put on the show notes so everybody has access.
Perfect.
And so what would be the best advice you give to clinicians that are starting their careers?
Find a mentor.
Yeah.
Drive further, take less money, but find a mentor. Be taught by someone doing something that you want to do, and buy them a cup of coffee. Be persistent. Get in front of them. Be respectful. Don't be entitled. Take less money. Drive further to a further clinic and learn from them. And that's so powerful. If you can take that humble approach and truly learn, good things will happen.
I had other guests that they said the same thing. So I've been listening to this a couple of times. And the last question. So what personal qualities and abilities that you think are important to become a successful physical therapist?
Yes. Somebody that can connect with people. I've been in this field a long time, and I don't care how smart somebody is and what they know. If they can't truly connect with somebody and have a social awareness where they can connect with somebody, then they will only be so successful. If they can tie that ability to truly communicate verbally and non-verbally that they truly care about somebody, and they truly do care about somebody, not just state that, they will have a motivation to push beyond just what's written on a protocol or what's written on a piece of paper. And that's the kind of person and personality that will go with that person to a doctor's visit with them because they care about that person. That's the person that will go see them at their house because they can't get out. That will be the person that will meet them on a track or go for a run with them. And that's just the personality that you have with that. If you can have a humble approach and have a thirst for knowledge on top of that, then you've got all the makings to then learn and be mentored.
Well, so I think that's pretty powerful. If you can connect and you don't have empathy and you don't truly want to help your patients, I think you are on the wrong career, right?
Yeah, it's there's a lot of different personalities out there, but when you look at who I want to surround myself with, and because you want to surround yourself with people that are better than you are, so everyone's learning from each other, those are the personality traits that I have to have, that I look for.
Yeah. Chris, so if our listeners want to learn more about you, or they want to, how they can find your contact information?
So you can, you might be able to Google me. I'm not sure what will pop up, but nothing that I have to be, concerned about. But obviously, I'm based out of Nashville. I'm centrally located. Chris Wolfe, Wolfe is my last name, and my business is Wolfe PT. A lot of people ask me what the PT stands for. People think it's physical therapy. A lot of times I say it's performance therapy. So it's Wolfe Performance Therapy. That's our website, www.wolfept.com, and you can find us there. We'll be actually showcasing a new website here pretty soon. We'll actually have a source of information there. We'll also have a blog posting there where I hope to kind of highlight those people that I just mentioned, a lot of resources they're putting out. I'll be doing some resources of my own. But yeah, that'll have all my contact information on that. Usually my cell number as well, and my email address. But I love getting emails from people. Sometimes I can be slow to respond to those, but I'll try to get back to them as well, just depending upon time. And but yeah, you can find me via website.
Perfect. Chris, thank you so much for taking the time to talking
Certainly.
Today with me, and I really appreciate it. Learn a lot about this athletic way, a lot of new things that I didn't know, and I'm sure my listeners learn a lot too. So thank you very much.
You're so welcome. Thank you so much for the time today.